Big companies don't want competition. Why do they not want competition? Because they want to be able to do bad jobs. Goes back to why do they hate Healthcare Henry so much? People are asking, you want to get into Healthcare Henry Academy, what's going on with the home health? CMS just cut home health payouts by 1.3%. You heard it here first. This is, to me, right, one of those things where, because we have to do these things called cost reports, where we submit to the government what it is that we're using the money on and how it's working and what's going on with it. I've been saying this for years, right? Everyone's all upset, everyone's up in arms. I do believe a lot of this is tied to, when they get those cost reports, a lot of the payments are paid out to the C-level executives. So whether you hate this administration or not, some of it has to be taken into account for. That's what they're saying. Hey, these guys got home health companies. They're profiting 20-30% a year. And of that, what's left is all going to the directors. It's all going to the ownership group. That part of it doesn't really make sense. Now, if you want to get into this business, yeah, you can make a great living. I've always said that. But there has to be some happy medium between doing everything we can for the patients and being able to make a living for yourself. Now let's go into it a little bit more. On November 28th, they finalized that the new home health system will get a 1.3% pay cut. Here's my concern with it though. The cost of everything is going up. Most importantly, the cost of labor. The cost of labor. One of the things that CMS needs to kind of pay attention to is, because the cost of labor is going up, we have to be able to account for that. We as companies, we have to be able to account for that. So if you're starting a company and you're the nurse practitioner, or you're the doctor, maybe it's not as big of a deal for you, but for other people, we have to be able to account for that. One of the things that I would pay strong attention to as we move forward, is it still doable? Absolutely. You can still get in here. You can still come into our academy. You can still do well. You can still figure out how to become a part of it. But just remember, if you get into the home health sector, which is different from home care, home health requires you to get, a lot of times, a certificate of need. And we'll get into that later, but simply put, a certificate of need is this piece of paper policy put in place, in my opinion, by big corporations who don't want any competition. It's simply that, right? Because why would you not want more home health companies? If you, Joe Blow, can afford to start a home health company, qualify to start a home health company, why would you not be allowed to have a home health company? It's simple. Big companies don't want competition. Why do they not want competition? Because they want to be able to do bad jobs. Goes back to, why do they hate Healthcare Henry so much? Because Henry came in, started a hospice, and said, you can no longer treat my people poorly. You can no longer give them bad hospice services. And I'm here, and now your margins are going to be significantly decreased. That's why you have all these hospice companies coming together, and they're going to hospitals and going to facilities and telling them, we can be your 1, 2, 3. And they say, don't use the purple people. Don't use Precious Hospice. It's because we care, and we're making them forcing adjustments on their actual profit. So can you still come in and do a great job? Only come in here if you want to make a huge impact on your community. Don't come in here just for the money, and you'll be just fine.